sent anyone asleep. There are three kind of main points that I wanted to talk about today. I wanted to talk a little bit about our brains, so what goes on inside our heads and our hearts. I wanted to say that in the last 10 to 15 years, the research is telling us quite a bit about what's happening in our heads, in our brains, through advances in imaging. And the bottom line is, the take-home message is that we have brains that we inherited, and they're tricky. They don't work for everyone, okay? They're tricky. And when we add in empathy, so we're all taught about the importance of developing empathy. When we add empathy into these tricky brains, they get even trickier. So I'm going to talk a little bit about that today in some caution. The other thing I'm going to caution about is mindfulness. I direct the program in UCD, I've been teaching it for a long time, but we've got to be very careful about understanding or seeing mindfulness as a cure for all ills and all remedies. It's not. And I want to be really clear about that. We, at some level, the science of mindfulness, the evidence base, the knowing what works, knowing what questions to ask about mindfulness, is all catching up with the practice. Everyone knows something about mindfulness now, but in fact, the evidence base is only building. So we've got to walk this with caution. The third thing that I'm going to talk a little bit about is the idea that what we emotionally, what we resist, what we push away, persists. Okay, so what we resist persists. And the idea that the probably one of the most helpful ways for us to manage our psychological or our emotional distress is to, ironically, or contradictory to what we might have been told, is to experience it fully. So when we continue to shy away from or avoid our emotional experience or psychological experience of pain, it gets worse. So I'm going to talk a little bit about that. But before we do anything, if you could just put down what you have in your lap. So if you've got some note paper or some pens, just put it on the floor. And this is a pause break, kind of a 3-minute mindfulness break. So you're working very hard. So finding your feet, allowing both your feet to be flat on the floor. And if it's comfortable for you to close over your eyes, but you don't need to do that. If it's not comfortable, just to allow your eyes to rest gently just in front of you. And then to put your hand on your belly, so your right hand on your belly, and just to notice your breathing. Quite simply, noticing your breath, nothing else. Not changing your breath because it doesn't need to change. How you're breathing is more than okay. So just noticing the sensation of your own breathing. And then paying attention to your body. Noticing your feet on the floor. And then noticing how close your shoulders are to your ears. And allowing your shoulders to soften even a little bit. So it's often we carry our tension and stress and worry in the shoulders. So allowing the shoulders to soften. And then bringing attention and noticing what's going on in your heart or your emotions. So if you can, just kind of say how you're feeling to yourself. Happy, sad, bored, restless, joyful, whatever. Just you can kind of name the emotion. And then bring your attention back to the breath. Feeling the belly expanding and contracting. Knowing that how you're breathing is more than okay, it doesn't need to change. Just bringing your attention to the breath. And when you're ready to open up the eyes. So, a mindful moment. The John Kabat-Zinn, people may have heard of, introduced mindfulness in the healthcare setting in the 1970s. But John has said recently that, in fact, he probably gave it the wrong name, that it should have been bodyfulness, that we need to kind of move away from our minds, actually, and back to our bodies. we have our minds, we have our brains that have developed over millions of years. And much of what goes on inside the hard drive in our heads is not our design, it's not our fault, and in fact it's probably designed fairly poorly. I don't know who said it, but we are designed for survival and not for happiness. We reading a very interesting book recently called Ending the Pursuit of Happiness, because it's our pursuit of happiness actually that makes us unhappy. We are designed to survive and not to be happy, despite what we may have been told over the years. The important thing is we have a hard drive up here that we didn't create, we've inherited. And it's our tricky brain. And this brain, as I said, gets a little bit more tricky when we add in empathy. We've an old brain down here in the middle of the head. If you put your fist together, kind of like in here. And in here is where our emotions, our desires, our motivations, our basic motivations, and our relationship seeking happens. So those more basic or more primitive aspects of who we are as individuals operate from. And then we have this thing that I very simplistically call a new brain. And the new brain is kind of largely at the front of our heads, these lobes here at the front. And they're essentially where we do our thinking, our planning, where we do our worrying, our ruminating. It's where we imagine wonderful things and awful things. It's where our self-awareness is and our identity is. So all of those aspects of ourselves happen in this part of the brain, in the new part of the brain. It can get tricky because in this very simplistic version, because this is how I can kind of think about it, this can get tricky because the old and new brain don't always communicate in a very good way. We find ourselves here, like the man at the top of the evolutionary progress there, where we have moved from a species where our concern was about eating, our survival, and our ability to reproduce, to a capacity as human beings where we actually begin to ask ourselves questions about what is it all about? Who am I? What's it worth? We begin to ask these questions, and these questions are difficult and challenging. We, unlike the chimpanzee or the monkey, you know that if you've had a dog, for example, in your life, really the dog is not concerned about what's going to happen tomorrow or what happened yesterday. It's present focused. And we are, of course, because we've got to plan. And there's nothing wrong with that. But it causes us problems because we begin to think into the future and we begin to plan. And if you're anything like me, you probably insert the worst possible scenario. Yeah? So there's a gap and we insert, or we remember what went wrong the last time. So like the last time I was here, I remember that, right? And then that affects how I am right now. Our capacity to worry about how we are going to appear in the world. This is unique to us, and it's unique to our new brain. It's unique to this part of our brain. This is unique to us. So our concern about how do I appear, how do I look, am I going to be valued and respected and loved? And again, that idea that the new brain asks us to question and to judge and to criticize our natural responses and experiences. And interestingly, when it comes to empathy, and those of us in the helping profession know that animals don't do courses in empathy building or becoming a more empathic person. Us in the caring profession, there's a great emphasis on developing our skills in empathy. And that's quite a burden to this brain. And in the literature, there are two kind of areas of empathy: a kind of affective empathy, our empathy that's related to our feelings, and cognitive empathy, empathy that's related to kind of how I think, or how I think you might be thinking. So our ability to take someone's perspective. Again, in the literature, there are probably three key dimensions to empathy that are worth talking about today. So empathy really does involve our ability to take perspective, right? To think about how the other person may be experiencing an interpersonal situation. This idea of theory of mind, that, and those of you with children will know that a child will begin about 3 or 4 years of age to realise actually that the other child has something going on that's not going on in my mind. And that's called a theory of mind. We suddenly go, oh, actually, your mind is different to mine. Hopefully. The empathic concern, that we have concern for people's feelings and a concern for others. So just that genuine concern. And then personal distress, because when we become when we have empathy, we experience discomfort at the emotional experience of other people. So we see someone in distress and we become distressed for them. Our old brains, as I said, these brains that we have are tricky, and then we add in empathy and they get even trickier. These new brains that we have, so this new part of the hard drive, hardware that we have in our heads, are generally shaped by our early environment, by the early attachment experience that we have. So when it comes to imagination and relationship formation, when it comes to thinking about possibility and problem solving, when it comes to a sense of safety in the world, those areas of the brain, those areas of mind and heart, are generally formed from our early experience. And many of us, if we had the choice, may have changed our earlier experience. We may have opted for a different script in our lives. The brain that we have come to know a little bit more about over the last 2 decades, and researchers in the field refer to the brain as having a default network or default mode. So this is the experience that we've all had, that the brain has an incredible capacity to wander, a tendency to wander. So you know the idea when you are sitting in traffic or you're lying in bed at night trying to go to sleep, the mind wanders from A to B to C and back. So it's almost like a kind of a roundabout. And this happens when we're not paying attention. So when we decide to pay attention, as you did to your breath, for example, the mind can focus on that. Otherwise, that's the mind's default network, is to go to all of these different possibilities. And generally they are possibilities. And generally they're worst case scenario. This is a function of the brain that has evolved over years in order to keep us on our toes. And this basically is about better safe than sorry. So if we think about the worst possible scenario, right, we're actually, as difficult as that is, we're better off thinking about that because it's going to keep us safe. The problem is when we begin to think like this over a long period of time, that various areas of the brain are stimulated so that there's a path worn for us to think, for us to worry, for us to be concerned, for us to be disconnected from ourselves. So we actually wear a pathway in the brain, and that keeps our minds on the move. You know that kind of, you know the tired but wired phenomenon? You know that one where you're actually physically exhausted but mentally wired. Because we've done a lot of training in our brains in order to keep ourselves that way. So it could be the anxiety, girl or boy, but that ability to jump to the worst conclusion in a single bound. And that is part of the better safe than sorry. So I might think today coming in here, yeah, I'm really, really not going to do very well and they're all going to get very bored, right? And that in some way keeps me on high alert, right? So not necessarily a bad thing. The problem is when we get stuck in that. Anyone recognize this? The thing is, our brains leave us very, very vulnerable to overload, to thinking of a potential possibility and outcome. So you might recognize that experience yourself. How we respond and react to and appraise our problems is key. This is why the importance of psychological or emotional counselling interventions, that this is not something that's set in stone, that there are ways, and we learn from cognitive therapy over the years, to reappraise and evaluate our problems. And key to our experience of distress is our ability to appraise and to evaluate. But key in that is awareness. So we can only reevaluate how we're thinking if we know what we're thinking. Otherwise, we get stuck in the fight or flight. You know that fight, flight, or freeze, where we are wound up, ready to pounce, ready to run away all the time. That system, biologically and psychologically, is really important for us. It ensures our survival. So it's like you're standing ready to cross the road and a kid walks out in front of a bus. What do? You don't think about that, you respond immediately. That's really important. We never want to lose that. The problem is when we get stuck in fight or flight all the time, when we get stuck in high alert. Does that make a bit of sense? That's not how we need to live. The problem is we have a tendency, as you know, in our minds to live in the past or the future. And we have a big problem living in the present moment. And depending on probably some of the early experience in our lives, we will have a tendency to focus on the past and probably be depressed, or focus on the future and probably be a little bit more anxious. We get stuck in what's been referred to as reactivity, where we are reacting in our lives. We are on automatic pilot. And this automatic pilot prevents us from seeing clearly, from solving problems and expressing our emotions constructively. So when we're on high alert, when we're in fight or flight, like the cat, we don't solve problems and we don't communicate emotionally very well. And I mean, all you need to do is think about that is at a time of stress or difficulty, our worlds just become narrower and narrower and narrower and narrower. And we don't solve problems and we don't communicate properly. The problem about this is that a lot of it can be unconscious. It results in us being on high alert. And this model is based on work probably over the last kind of 40 years or so that looked at stress and our ability to cope. More recently, John Kabat-Zinn in the 90s emphasised that our awareness of our options and our ability to develop automatic pilot. So we can live our lives unconsciously in the past or the future, or we can develop an awareness for the present moment. So noticing this breath in this moment, these feet on the floor. Noticing how close your shoulders have gone back to your ears is a really good way just to come back to this moment, to take ourselves out of automatic pilot. Mindfulness began in the late 70s in the University of Massachusetts with John Kabat-Zinn, and there are over close to 20,000 individuals have gone through the program in the University of Massachusetts since it was established almost 30 years ago. And this essentially was the application of some contemplative or meditative practices in a healthcare setting. And John Kabat-Zinn began this work with people with chronic pain. And doctors were going and saying, there's nothing we can do, it's hopeless. And he thought, well, actually, why don't we teach them how to meditate? And that's what happened. So mindfulness is a way of developing our ability to pay attention in the present moment, non-judgmentally, to be curious about our experience. And that takes work. Someone described it recently as it's like brushing your teeth or minding your teeth. It will not happen. It's no use going to the dentist or the person who cleans you, the hygienist, once a year. You've got to do this every day. So learning to be mindful, learning to be in the present moment, to come out of automatic pilot, is something that involves a commitment and a practice on a daily basis. Very quickly, what mindfulness is not. Mindfulness is absolutely not about trying to relax. Mindfulness is not a religion. It's based on some largely Buddhist or contemplative traditions. It isn't. It's a secular application. mindfulness is not about transcending ordinary life. Sometimes people have the idea that if we become mindful, well then we don't become distressed or pissed off or frustrated or annoyed. That's not true at all. The idea is that we go more fully into our experience. And it is certainly not about emptying the mind of thoughts. We always say to patients when we teach the program in the hospital that as long as you're breathing, your mind is going to wander. So the mind will wander. It's what they do, it's what they're evolved to do. They have evolved to look out for danger, to be on alert, better safe than sorry. And mindfulness is not difficult. I'm not sure about that actually, I think it is. And mindfulness is not an escape from pain, but actually it's a way of entering into our pain more fully in order to ease. There are two basic interventions in mindfulness, mindfulness-based stress reduction and mindfulness-based cognitive therapy, both developed over the last 30 years. Again, I'll go through this very quickly. Mindfulness-based stress reduction, established in the States in the late 70s. And more recently, mindfulness-based cognitive therapy out of Oxford about 15 years ago. And both manualised programs. Mindfulness-based cognitive therapy is now recognised and recommended by the UK's National Institute of Clinical Excellence as an intervention for people and recognised to be as effective as antidepressant medication for people with recurrent depression. Mindfulness is gaining ground in the research literature. I think this is up to 2011. I couldn't find anything more recent. So that's the number of publications that have happened about mindfulness since 1980, where there was zero. So this is gaining a strong foothold in clinical application and in research. So asking the questions about what is working here, what is not working here. These are the peer-reviewed, publications up until 2013. You can see there are 240 in mindfulness alone, and grants awarded in the area by the NIH up to 2013. So this is a big area, and this is the piece that the work that Barry and Gary are going to contribute, both in terms of hopefully grant funding and in publication. The research tells us that mindfulness is good for various things: heart disease, improving our immunity, fertility, focus, anxiety, blood pressure. But John Kabat-Zinn, again, the man who introduced a lot of this, emphasised that during mindfulness we develop an awareness of our options and the ability to come out of automatic pilot. He also describes, which I really like, the idea of coming to terms with things as they are. So he says that actually healing from an emotional and or physical point of view is about coming to terms with things as they are, rather than changing them. The skill that, psychologically speaking, so people do some mindfulness training, and the skill that they learn is what's referred to as metacognition. And metacognition simply means the ability to think about our thinking. The ability to think about our thinking. So here I am, having thoughts, having feelings too, and developing the ability to think about them. As the first option, first stage, got to know what's going on in my own head. Important to say that the attention training, so learning to think about our thinking, we need to be careful about that. And I always remember the piece from Eliot. He says that humankind cannot bear too much reality. So we've got to be careful about what we expose ourselves to. And as I said at the beginning, the science and the evidence base is catching up with the practice and popularity of mindfulness. So we've noted caution around it. Through some of the research and the people who are writing and thinking about mindfulness more recently, the area that's gaining prominence is compassion. So there were a couple of studies done. That said basically what seems to be bringing about the change for people who undergo mindfulness training is this idea of compassion. And I'm going to go on and talk a little bit about compassion now. The compassion has been described is understood as the ability to suffer with. So coming from the Latin compia pati, to suffer with. And it is a deep awareness of our suffering coupled with the desire to relieve it. And compassion has two main pieces. It's the ability to open up and tolerate and understand our suffering, and the psychology of knowing how to alleviate suffering and remove its causes. So we tolerate it, and then we look at a way of alleviating it. Again, compassion has been referred to as the acknowledgement that not all pain can be fixed or solved. That there are emotional, psychological and physical pain that cannot be fixed, but that the suffering we experience is made more approachable in a landscape of compassion. The Tibetan word for compassion involves compassion for oneself, and the Dalai Lama has said that if your compassion does not include yourself, it's not complete. And in fact, it's only in the English language that we use the compound word self-compassion. In other languages, compassion naturally involves oneself. There isn't a distinction between me and me being compassionate for someone else and being compassionate for myself. But in our language, we've introduced the concept of self-compassion. Self-compassion, having a common humanity where we see ourselves as part of the bigger picture, having self-kindness, and being mindful. And self-compassion is, the more recent literature is telling us, it's linked to our biological experience. We did a very small study in the hospital 2 years ago. So the intervention group, or the intervention in green, so you can see their depression reduced significantly, and their self-compassion increased. And their telomerase activity, an enzyme in the chromosome, actually changed as a result. So we saw biological changes taking place over an 8-week period. These were a group of patients. One of the concepts in mindfulness is this idea of the second and third arrow, that we have an experience in our lives that we don't like. That's inevitable. We grow old, we get sick, people we love die, things go wrong. There's no changing that. What we do have the option of changing is the second or the third arrow. And the second and the third arrow are the resistance that we put in place when the inevitable happens in our lives, when things go wrong. So the criticism that we can often levy on that, the refusal to accept what's actually happening. The Dalai Lama says that it's not our experiences that cause us suffering, but it's our resistance to them when we push them away. Self-compassion correlates, the literature tells us, with a whole host of positive life measures. We find ourselves as human beings here with this apparatus in our heads that we're not responsible for, old brain, new brain. We find ourselves here having evolved. We didn't choose to be born. We didn't choose our genes. We didn't choose our emotional state. Most of us didn't choose our name. We didn't choose our basic temperament. We were born this way. We didn't choose our body and how it works. We didn't choose our basic human desires and needs. These are all pre-programmed. And we didn't choose the time in history we were born. We made none of those choices. So much of where we find ourselves today is simply not our fault. We've inherited so much that we're not responsible for. But we add a second and third arrow to ourselves by blaming ourselves. Self-compassion is very different to self-indulgence. So when we talk about self-compassion, patients always say, well, if I become more self-compassionate, I'm going to let myself off the hook altogether. I'll go wild, I'll reuse, I'll relapse, I'll do all of those things. But we know from the literature, we know from experience, that self-compassion is very, very different to self-indulgence. Self-compassion at times involves saying no. Self-compassion involves making very difficult decisions in my life. We, to summarise, and I'm going to finish now, really important from what we know in the mindfulness literature, what we know in terms of our self-care, is that we do not believe everything we think. And actually, when we find ourselves really, really, really knowing that we're right and really believing something, then is the time to really challenge it and question it, because then is the time you're probably. So, thank you very much.